Hi, how's everybody doing? Hope everybody's doing well. So in this video, I want to talk about esophageal pain or esophageal spasm. And that's something that kind of just came up for me recently. In the last few weeks, it has been creating some very disturbance in my lifetime, in my lifestyle. And it's causing a lot of discomfort and a lot of annoying unwanted sensations. So it's kind of like altering my lifestyle at the moment, and it is a problem in my life at the moment. So it could possibly be esophagitis. Esophagitis is basically an inflammation of the esophagus. I'm not 100% sure because I have not been diagnosed with esophagitis yet. It's just my speculation, but I know it is esophageal pain. Now, if it is esophagitis, there's actually a few types of esophagitis. Now, the current esophagitis that I have, it seems like it could be food induced. And there's a certain type of food that I'm still trying to nail down to see exactly what it is. But a certain type of food that when I eat, it makes my pain a lot worse. So it could be, more food induced. And when it's food induced, there's a different term for this esophageal pain, esophagitis. It's called eosinophilic esophagitis. It's like medical terms. It's kind of hard for me to pronounce. I'll put it up on the video. So, has anybody experienced, esophageal pain, esophagitis, or anything like that? You probably know how it feels. It's kind of pretty bad, and it's really interrupting my lifestyle at the moment. So, disclaimer, I'm not a doctor, I'm not a medical professional. Everything I talked about are basically experience of my own and knowledge I acquire along the way of learning what these conditions are, and treatments and other treatments that's been used or prescribed for my own use only. If you have any medical concerns, medical questions, please refer that to your doctor. They can give you the best advice. Thank you. So I have esophagus sensitivity for many years, and I'm talking about decades. And I've been seeing my GI doctor for a very long time. And we knew I have sensitivity because sometimes, depending on certain stuff I eat, it kind of acts up, but it was never to the point that it kind of felt like it's kind of painful recently. It was not very much painful. It's just a little annoying, and it will actually probably go away a lot quicker, but it'll linger on for a little bit. But recently, it kind of linger on for a much longer period of time. So the most recent symptoms I've been having with this esophagitis or esophageal pain is mainly chest pain in this particular area, like heartburn, a burning sensation is on there. The other really bad sensation is nauseous. I'm feeling quite nauseous actually sometimes, so it feels like a flu. And sore throat, and a sore throat area. I don't know what's caused it. Swallowing issue. There's not. I don't really have any swallowing issue, but sometimes when I have sore throat, it could get. It feels like it's a little bit painful just to swallow, so that's not good. And I've been reading all these things on Google, all these medical websites. It doesn't mention these sensations, but I can tell you when I have these esophagus pain, it's causing a lot of my cognitive issues. And I think that's due to because of the vagus nerve. The vagus nerve is very much interconnected with the whole GI system in the body. And anything that happens in the body, it sends signals back to, the brains and and it caused all kinds of issues. So I'm having like brain fog, like constantly when I have these esophagus pain, I start feeling like brain fog where I cannot think, like memory loss. I all of a sudden or brain freeze. I can basically just forget about uh, what's happening. I couldn't think of anything. Um, I was not focused. A little bit disoriented. Feels like I'm not in control of myself. Um, Memory loss, and sometimes when it happens and people ask me to think of something, I cannot. It cannot come up. My brain is just not functioning. Um, Blur visions. Sometimes I'm seeing doubles. Sometimes it's just fuzzy. Um, I never uh, blacked out, of course, but it seems like I cannot focus on things. I can see, but it seems like I'm not focused on any objects or wherever I am or whatever I'm seeing. Um, yeah, that's a really a scary issue, and if I'm out there driving, um, it's a little bit problematic. Um, Also, the other related issue is GI. I can have stomach ache down to my stomach or stomach upset, as well as my colon. I can have diarrhea. Suddenly, if I'm feeling these sensations, I can feel like I needed to go. So, yeah, it's very. There's a whole host of issues that can just disrupt your life. The other issue that is very big, and it's a major cause is anxieties and depression. It brings out a lot of anxiety because when I'm not feeling good, when I have chest pain, my anxiety kicks in overdrive. I'm worried about that something might happen. And then depression. When I'm not feeling well, I'm extremely depressed. I don't know what's causing it. I don't know why it's happening. And at that particular moment, I don't know how to solve the issue yet. But I just need to wait it out sometimes. And there are some medication that I can take to help. Um, and I'll talk about that in a minute. Now, diagnosis. I have not been diagnosed with esophagitis, meaning my doctor has not seen any inflammation in my esophagus, which is good. In the last 20 years or so, maybe I have done at least 5 upper endoscopy to look into my stomach as well as my esophagus because I have GERD. I have it's not major. I have GERD. I have gastro reflux disease, and it came from many years ago, and I'll cover that in a minute as well. So every few years, every 5 or so years, my doctor wants to look into my stomach to see if there's anything that's damaged, any ulcers or any um, other particular issues in there. And luckily, the most recent one was done less than 2 years ago, and the doctor did not see any inflammation in my esophagus. But however, we do know that I do have esophagus sensitivity, and I'm just very sensitive to many other stuff that's going down the food pipe. So in regards to GERD, over the last 20, 30 years, I have a bone disease, an autoimmune disease that causes damages to the bone. And I've been taking a lot of non-steroid anti-inflammatory drug, and those can really cause stomach issues. So many years ago, I have been taking PPIs or H2 blockers for many years just to compensate the non-steroid anti-inflammatory drugs. So my GERD is still there, but over the many years, I slowly tapered off and stopped the PPIs and other antacid medications. So all these endoscopies, my doctor tells me my I do have GERD. I also have hiatal hernia, but it's not really major that it can push acid reflux or acid up to my esophagus, and it can damage my esophagus. But it's very minimal. So I don't believe my esophagus or esophagitis, esophageal spasm is coming from my GERD. So the treatment for this is my doctor actually prescribe PPIs, again, like I said, H2 blockers, and I do have that, omeprazole, and I start taking those again in the last 2-3 weeks, as well as I'm also taking Sucralfate. Sucralfate is a medication that a doctor gave to me to coat my stomach, but he told me to actually dump it into water, dissolve it into water, and then drink it. So hopefully, when it goes down the my food pipe, it can it can catch some of those sucralfate on the way down, and it can coat my esophagus as well. So I've been doing that, and actually, it helps. It helps in a way, but not entirely. And speaking of treatments for esophagus sensitivity from many years ago, it's interesting that there's really no specific medication that is directly aimed for the esophagus, but it's always medications that treats the cause of what's causing the esophageal pain. So, but as far as sensitivity goes, the treatment for the sensitivity is actually, surprisingly enough, it was antidepressants. I don't know why, but I guess it's because the guts and the vagus nerves are so closely related. It caused anxiety, and the antidepressant will actually block some of those sensations. That's my speculation. So my doctor actually gave me some. My GI doctor actually gave me some amitriptyline. Amitriptyline is a old antidepressant, but I'm not handling that medication very well. I get very drowsy and sleepy the next day. I almost felt like I'm not staying awake. Even when I take the smallest dose, he gives me the smallest pill, the smallest dose pill, and I have to cut that into half, and I just take half, and even that keeps me from waking up or being awake. But what's interesting is that I do have anxiety, and anxiety disorder. I am seeing a psychiatrist as well, so I have many different conditions, and I'll talk about anxiety in a different video. My psychiatrist gave me some benzodiazepine. That's a control medication, not something you want to abuse. I take those very, very low dose. Before, when I don't have this problem, I would probably take it like once, a small little dosage, once in every 3-4 days, or even once in a week. And in the past, I haven't even touched that, like once in 2-3 weeks. So it's a very small dose. But what's interesting was that I actually found that benzodiazepine actually help takes away the sensations, these pain sensations. It was working well when I have these sensitivity pain. I guess the sensitivity pain is also very much the same as now. It's just probably a little more severe recently. But recently, with the severity going up higher, the benzo did not work as well. It still works, but it's not working as well. And if I have a level of pain, say a level 7 of the pain from a scale 1 to 10, the benzo right now will take away a third of, maybe a little more than a third of that. So less than half. But before, when it's not as severe, when my sensitivity pain was just on a scale of 1 to 5, I mean, 1 to 10, it's a 5, not as severe as now, a 7 and an 8. And I take a benzo, and it'll go down to, my level will go down to probably like a 2 or even a 1. The sensation kind of go away pretty quickly. But yeah, like recently, it's a little more severe. So the benzo was not working as well as it should be, and I've been taking a little bit more um, frequently, maybe like twice a day, two small little, half of a tablet twice a day, and that's still a very small dose. Now, I don't want to abuse those because sometimes there is a withdrawal with those, and it could put me into a very bad anxiety or depression as well. Now, I am seeing a doctor in the next couple of days. I'm hoping to talk to him and see if there's any other particular treatment that can gives me a little more relief than amitriptyline. Amitriptyline, I just cannot stay awake, and I don't find that it actually helps too much because I've been taking it for the last week or so, feeling very sleepy in the day, but I don't feel the sensation going away. It's still there. So I'm hoping maybe there's something else that he can give me that can take some of the sensation and possibly maybe get to look into that. And hopefully there's still no damages, and it's still the sensitivity. And I'm pretty sure that actually, it is kind of like food induced because when I eat certain things, it can cause more of the pain than anything else. I like to see if anybody actually, have been through, with the esophageal pain and all that. It would be nice to see if anybody has gone through it and, share some information with me. I like to learn as well. I want to see if there's anything that I can use as well. And then, hopefully I can get to talk to my doctor and vice versa, with the sensations and things that I talked about. I just want to share with people, if you ever have this particular issue, these sensations and burning in the chest, and make sure, you want to talk to your doctor and make sure that, it's not a heart problem because it's the chest is very, very important. Make sure you want to find out it's not a heart problem, and when that is certain that it's not the heart, then you can look elsewhere and then talk to your doctor about, the other sensations that's causing it. And anxiety is another big issue because it's so much interrelated. I've been having a lot of these, like I said, the anxieties and depression that's coming up. My jaw actually hurts, and that's part of like depression that I'm crunching my jaw recently because of the pain. I'm feeling a little bit sad because of this particular issue. So, if you ever have these particular issue, make sure you talk to your doctor. I am seeing my doctor in the next couple of days, and hopefully, there are more solutions. But yeah, the PPIs, the Sucralfate, it's actually doing a little bit of the help for me, as well as the benzo, and that's all medications for me. Okay, so you must speak to your doctor, and I like to see what other people is taking as well. Have you taken any supplements that is helping, any sort of other vitamins or things like that? That would be great. Thank you so much. That's all for my video today. So if you like my video, please give me a like and subscribe. I will have more videos coming out in regards to other particular issues and want to share with people, and hopefully I can learn from other people as well. So thank you again. I'll see you on the next one. Have a nice day. Bye bye.